today I'm going to perform a general physical examination on my patient, and I'm going to ask for his consent and also ask for his consent, and also explain to him the procedure as I start. So good afternoon, sir. What's your name? Samuel Japheth. Do you know where you are today? Which county? Kilifi. Okay. What school do you go to? Northwest. Okay. What number is this? 1. Okay, thank you. So my name is Nurse Mary, a student at Local College, and today I will be performing the general physical examination on you. It will require you taking off the certificate and also some contact. Maybe you feel uncomfortable. Are you willing to go on with the procedure? Okay, thank you. So I am going to start with inspecting your hair to see for any masses, the distribution of the hair, the color, the hygiene, okay? Yes. So can you do this? So as you can see, the hair is well distributed, black in color. I can see no abnormal patches of any infection. And now I'm going to palpate to feel for any masses. Do you feel any pain? And also the hair has no lice, so which means his hygiene is good. Yes. Now I am going to move to the eyebrows. The eyebrows are symmetrically aligned. They're black in color. Yes. And the hair is well distributed and there are no masses or patches. Then I'm going to move to the eyes. They are symmetrical. The eyelashes are black, well distributed and well arranged according to how they're supposed to. Now I'm going to assess for the eye movement using my pen touch and also the constriction and dilation of the pupil. So I'm going to do this. The pupils constrict upon light, which means the eyes are good. And now I'm going to ask you to follow the movement of this pen, okay? So when I bring it closer, follow it, and then I take it back closer, okay? So the eye movement is normal. Do you stay? Okay, so the eye color, the sclera is white in color, which means there's no jaundice. And now I'm going to look at the conjunctiva is pink, which means he has no color. Yes, his blood levels are normal and oxygen is well saturated. And now I am going to palpate. Do you feel any pain? Do you feel any pain? Okay, so I am going to move to the ears, and I am going to look for any masses, how symmetrically aligned they are, and any abnormal patches. So the ears are well aligned, symmetrical, the face, and there are no patches or any abnormal masses. And now I'm going to move here, and I say a word, you tell me what I said, and I'll do the same to the other ear, okay? What did I say? Hi. Correct. What did I say? What did I say? Hello. Yes. So that is fine. We are done with the ears. And now I am going to move to the nose. I'll again need my pen touch to look at the color of the mucosa membrane and also to look at the hairs and any abnormal growths or masses in the nose. Yes. So the nose is at the center of the face. It's well aligned, symmetrical. Yes. And he has 2 nasal cavities. Yes, which are symmetrical. And the hairs are well distributed. There are no abnormal masses or growths or any patches. Yes. And he also has well distributed hair in the nose. So I am going to move to the mouth. So for the mouth, the lips are moist. Now I will ask you to do this. So the tongue is pink. Frenulum is pink. The dentition is well. Well, his mucosal membranes are pink and they're also wet, which means he is well hydrated. Now I am going to assess for the gag reflex. Okay, it's normal. And now I want you to move your tongue. Pardon me, no trouble, yes? Okay, we are good. So now I am going to go to the neck. I'll ask him to do this and move his head to the side. Can you do this? The other side. This. Thank you. So after he has rotated his head sideways, I see the muscles of the neck are fine and the nerves as well, because he's doing it with no trouble. Do this. So he has no labia distension. Yes, now I'm going to assess for the lymph nodes. So let me start with the occipital. Do you feel any pain? No. I'm going to go to post-auricular. Do you feel any pain? Pre-auricular. Do you feel any pain? Don't? Okay. Tonsilli. Do you feel any pain? You don't? Submandibular. Do you feel any pain? Sublingual. Do you feel any pain? Submental. Do you feel any pain? You don't? You're fine. Okay. This is supraclavicular. Do you feel any pain? Do you feel any pain? Do this. Do you feel any pain? Any pain? The other side. Do you feel any pain? Any pain? Well, his notes are doing fine. So now I'm going to ask him to take off his shirt, because I am going to assess for his abdomen, for any patches, bruises, scars, masses, and also oscillate for lung sounds, heart sounds, and also abdomen sounds. Okay, so please, are you able to remove your shirt?
Okay.
Okay, so I asked my patient to remove his shirt. Now I'm going to assess or to inspect for the abdomen and chest, skin color, any masses or patches, any scars, any tinglings, and also whether the breast is symmetrically aligned. Yes. So the color is normal. There are no abnormal masses or patches. Yes. So I'm going to ask my patient to lie down. So I'm going to inspect for the chest. There are no masses, there are no abnormal patches. And now after that, I'm going to palpate to see if he feels any pain. I start with the second intercostal muscle. Do you feel any pain? You don't? No pain? No pain. So I was palpating for the lungs. Now let me palpate for the heart. Any pain? Any pain? Any pain? Any pain? Any pain? No pain. Okay, now I'm going to focus to listen to the sounds. Okay. Okay, the sounds are normal. Now I am going to oscillate for lung sounds. So I'm first going to see, ouch. Yeah, so my stethoscope is working fine. Yes, so now I'm going to oscillate for lung sounds and I'll be able to tell. So I start with here. Okay, so now I'm going to lung sound. So now I'm going to do the heart sound and the diaphragm. Okay, so I'm done. I'm done auscultating for heart sounds. Now we will move to the abdomen. Okay, so I'm also going to listen to the vibrations while he's talking from the back side. So, did I give you a word or should you choose yourself? Okay. Say ice cold cold powder.
Ice cold cold powder.
Ice cold cold powder.
Ice cold cold powder.
Say it again.
Ice cold cold powder.
Yes. The vibrations are normal. So I'll ask you to lay back down so that I go to the So I'm going to go for the abdomen and I'll first inspect, then auscultate, then I'll palpate and percuss to avoid disruption of the normal vowel sounds. So now, so for inspection, there are no abnormal masses, no scars, there are no patches, and the skin color is normal, it has no discoloration. So I'm going to auscultate first because I think I have to do that to avoid disruption of normal vowel sounds. So I'll again use my diaphragm. So his bowel sounds are normal. And now I'm going to palpate for any pain. Do you feel any pain? Do you feel any pain? Pain? Mild or severe? On a scale of 0 to 10, how do you rate your pain? 4. Do you feel any pain? Do you feel any pain? No. Do you feel any pain? Okay, now I am going to percuss for your lung, for your abdomen. Now I will also. Do you feel any pain? Pain? Do you feel any pain? Okay. So I'm done with the abdomen. I'm going to ask my patient to sit. Double your legs. So now I'm going to assess for the lower extremities. I'll first start with the arms for the strength with this. So I'm going to push and you resist, okay? And when I pull also resist, okay? Yeah, very strong. Okay, so his arm strength is fine. And now I'm going to inspect also for the skin. There are no patches, no muscles. Can you do this? He has no pallor. Do this. Capillary refill is within 2 seconds. Now can you do this? Yes, he has no flat clubbing. Yes, now I am going to go to the legs. Now I'm going to check for the skin target. when I try to do this, resist, okay? Well, he is strong enough. And now I am going